Okay, thanks Tom. Before I start, I too would like to acknowledge Arante people, country and thank everyone for the welcome this morning and yesterday. Without further ado, because I think I've got 20 minutes and usually I rabbit on, so I'll try and cut down the rabbiting on and just give you a very brief overview of the project. The purpose of the project, I'm not going to talk about, there's two elements to our project. One is a critical response project, which I won't speak about now. I'll speak about the main project, which is coming to a close. But the purpose of the Aboriginal and Torres Strait Islander Suicide Prevention Evaluation Project is to develop an evidence base about what works in Aboriginal and Torres Strait Islander suicide prevention. Another aim was to develop a culturally appropriate evaluation framework, including a national interactive map of places experiencing high rates of suicide and available services to deal with that. Other aims was to identify Aboriginal and Torres Strait Islanders community suicide prevention needs, identify system level change for Aboriginal Torres Strait Islanders suicide prevention, and to host this national suicide prevention conference. We started off, we did a massive literature review and we also did a big program review. From the literature review, the two overall key messages that came out, and this will be repeated all through all the work we did, is the importance of cultural connections to build resilience. So that's very important. The second big overarching message was the need for community leadership and partnership for success. So that's what the literature review found. What we came up with too from the literature review, that things that were effective were alcohol supply reduction strategies, community prevention programs which improved social and emotional wellbeing, gatekeeper training programs, community consultation at all levels of any research or programs that are being established. Any research and programs that was undertaken needed to acknowledge the different cultures, values and knowledge systems of Aboriginal Torres Strait Islander communities. We found that mainstream biomedical methods did not work. We did a big meta-evaluation, just an evaluation of program evaluations, and earlier yesterday I think Tom said that it's important that we get our programs evaluated because it just gives it substance, guides the program and just gives it a bit more power. So we evaluated all the programs that were evaluated and found that various suicide prevention programs, the success factors in those programs that had rigorous evaluations, that success factors included peer-to-peer mentoring and education and leadership on suicide prevention. That important things were counselling, safe spaces for people to discuss their concerns, community site-specific, using community organisations, so things shouldn't be helicoptered in. We need to work with existing services or build them up in communities. The successful program showed that support materials such as DVDs, literature, but do not assume that everyone is literate. It might be videos and other ways of communicating that are important when you deliver a program. Successful programs connected with young people through sport. They connected through young people to their country, their culture and community life. Successful programs also connected young people to elders and they worked through a cultural framework. They also diverted young people from negative influences. They addressed cannabis use. They had an awareness of critical risk periods for people. Successful programs often were 24 24 hours, 7 days a week programs. We do need those. Community engagement, empowerment models to address negative social determinants and support social and emotional wellbeing were success factors. Again, gatekeeper training and postvention programs were important too. So we did the program review, the literature review. We developed a number of very good fact sheets which are on our website. Please go and see them. We also developed maps of suicide incidents and also where services are. They are on our website and the website of our partner. We have two powerful partners, the National Healing Foundation. The mothership is the University of Western Australia, but our powerful partner is the National Healing Foundation and also the Telethon Kids Institute. So their website has all the suicide incident maps upon it, so there'll be links from our website to that. But importantly for us, we could have sat down and looked at all the literature and programs and come up with the answers, and very hesitantly we thought we've still got to go out to the community and talk about things. So we did a number of round tables, community round tables. And when we started those, so we chose our sites because they either had high suicide rates or they'd had high suicide rates, but now we're dealing with them. So we went to Mildura, the Kimberley, Darwin, Cairns, and last week Adele and Jerry were up in down in Adelaide and Shoalhaven. So we did a good span of the country, having our round tables, inviting people to those. As we were doing that, we realised there were vulnerable groups in our already vulnerable group, so we did specific round tables on LGBTIQ, for youth, and on justice. And then as we were going along, we thought we also need expert inputs, so we called together expert meetings on data and statistics, also on clinical factors and on the critical response needs. So we did a lot of consultation, and that will all feed into a big report. But the round table messages, it was uncanny that wherever we went to different geographical places, but there were some fundamental messages that came through from the Aboriginal Torres Strait Islander community. And the big messages were that racism and the various social determinants of health contribute to a sense of hopelessness for many people. That programs must be led or partnered by community, and the mental health workforce must include more Indigenous people. Community members who've been bereaved through suicide are not receiving the level of access to service providers that they need. And again, many of those community roundtable reports, we've done a report for each of our communities and sessions that we have done, are on our website, or they're in the USB that you got in your conference bag. So I think, how's my time going? Yeah, right. Okay, I'll go on for a bit more. One of the things that will happen, this is in a sense the climax of the project, so having us come together and to discuss suicide prevention was important. We will be, all those community roundtable reports, all the literature review, the program review, etc., will be going into big summary reports. We will be presenting the government, and particularly Minister Scullion, with a big report, and we'll be making some very good recommendations from that. I think that you would have picked up already that there's common messages that are coming through. That one, Aboriginal Torres Strait Islander suicide is not like other suicide. It is different for us. That's number one. Number two is, when we deal with it, we need to have culturally appropriate methods. So that needs to always be a part of whatever we do. Culture needs to be a part of it. And then the third most important one is, working with communities. And going back to what Tom said earlier about there's a lot of NGOs doing good work, but only if they're working with Aboriginal communities. A lot of money's going to health and mental health, and there's slow gains because communities aren't engaged properly. When we did this project, we were hesitant because we thought, one of the things people say is that they've been consulted to death. You know, they always get consulted, but nothing ever changes. People do want to talk, they want to get involved, but they want to talk and get involved if there's real change. We hope that the work we do and the report we provide to government from the whole project and from this conference, you will see whiteboard, butcher's papers all around the edges of the wall there. We will be collecting every thought, recommendation and comment that you want to make to public and to government. So that is our purpose too. We hope to change things. We hope that the first ever Aboriginal Torres Strait Islander suicide prevention strategy that was frozen, it has money against it, will be released after we submit our report. So it's with great hope we've undertaken this work with brilliant people as well. We've had great staff members, great community people all being a part of this, but it will go somewhere. We will do our darndest to ensure that there is outcomes and a reality to this. It's not going to be another of those government reports that get shelved and, you know, gathers dust. So that's a bit of an update. It's very brief. Do grab me over lunch if you can, and also visit our website. So with that, I will hand over to Richard Weston, CEO of the National Healing Foundation. Thank you, everyone.